Hi students, the last topic that is acid-base disorders is respiratory alkalosis. Alkalosis means you all know decreased pH. Here the respiratory component is carbonic acid H2CO3 that is actually decreased. So increased pH and decreased carbonic acid. Actually in hyperventilation it removes all the CO2 from the lungs. That is why low concentration of CO2 that leads to decreased amount of carbonic acid. Actually, for the compensation, the PCO2 is decreased whereas bicarbonate is increased. Okay, these two are the associated features of respiratory alkalosis. What are all the causes? Actually, you just have some 5H, that is starts from H, 5 letters. Hysteria, hypoxia, high altitude, hyperventilation, hyperpyrexia, heart failure like congestive cardiac failure. So these are all the causes for respiratory alkalosis. And then coming to the clinical manifestation. With this respiratory alkalosis, that is increased pH and decreased carbonic acid, what are all the clinical manifestations? The patient will go for muscle cramps, then hyperventilation, then tingling sensation in the skin and hands, paresthesia because of the decreased amount of ionized calcium that leads to paresthesia for respiratory alkalosis patients. Next one, what is the compensation by the lungs or kidneys? Here the problem is in the lungs, respiratory alkalosis. So the compensation is increase the excretion of available bicarbonate. That means decreased renal bicarbonate reabsorption. Both are same, just I am telling. Increase the excretion of bicarbonate ions. Decrease the elimination of H2PO4. That is to prevent the hydrogen ion loss. Next one is decrease the urinary ammonia also. Decreased urinary NH4 means the aim is to preserve the hydrogen ions. We don't want to excrete the hydrogen ions. So these are all the compensation by the respiratory alkalosis. Actually, salicylate poisoning, initially it will produce respiratory alkalosis because of the stimulation of respiratory center. After that, lot of production of acids, they will go for metabolic acidosis. This is very important point for salicylate poisoning. By